In Europe, tick bites are occurring more and more often. Ticks are active throughout the year, but most tick bites take place between March and October. Ticks can carry a range of diseases. The most well-known is the Borrelia bacterium, which causes Lyme disease. There are all sorts of things you might have read about Lyme disease and long-term symptoms. If you have these symptoms, you might be worried. There is a lot of information available, but not all the information is all that clear or reliable. Some reports are even contradictory. Plus, we do not yet know everything about Lyme disease. Scientists and care providers do not always agree either. In Europe, a range of specialists and researchers are working together to identify, diagnose, and treat Lyme disease. One example is the North Tick Consortium, a group of European scientists and experts involved in multiple research projects and striving to increase the knowledge on ticks and tick-borne diseases in Europe. Most patients with Lyme disease have an expanding skin lesion at the site of the tick bite, but some might have more serious symptoms, such as joint swelling or neurological complaints. A minority of patients might experience long-lasting symptoms such as fatigue, joint and muscle ache, or concentration problems despite proper antibiotic treatment. This may well have a great effect on these people's lives. If you think you have symptoms that are related to Lyme disease, you can see your general practitioner about this. If a referral turns out to be needed, you can see a medical specialist at a regional hospital or possibly at a national Lyme disease expertise center. Expertise centers, and in fact also the North Tick Consortium, are there to support general practitioner, medical specialists, and other healthcare providers. We also share knowledge. Examples include information on tests that are not always suited to identifying Lyme disease, or information on treatments that are or are not recommended. In addition, scientific research is carried out to improve the diagnosis, treatment, and prevention of Lyme disease. It is good to realize that most tick bites do not lead to Lyme disease. Moreover, the sooner you remove the tick, the smaller the chance you will get ill. If you do get Lyme disease, it can generally be well treated with antibiotics. In some cases, however, the symptoms can be serious and long-lasting despite proper treatment. There are a range of factors that can cause such symptoms. We are finding out more and more about long-term symptoms during or after Lyme disease through solid scientific research. How often do they occur? Where do they come from? And what we can or cannot do about them. It is also good to realize that in such cases, additional treatment with antibiotics is often not needed. Plus, although it may take a while, most patients with Lyme disease will luckily recover following treatment. If you experience symptoms that you think might be related to Lyme disease, then please contact your general practitioner and stay in touch with your general practitioner, especially when symptoms might persist. In the event of serious or persistent symptoms, you may be referred to a regional hospital or national Lyme disease expertise center. There, they will examine the cause of your symptoms, whether it is related to Lyme disease or perhaps something else. You might still have some questions about Lyme disease or long-term symptoms. On the website of the European Centre for Disease Prevention and Control, you can find reliable information. Depending on where you live, there might also be information available on the websites of national expertise centres or public health institutes. Make sure you have the right information. That way, you can make the right choice for your situation together with your care provider. This animation was made possible by ZON-MW, the European Regional Development Fund and the North Sea region, Radboud UMC, the National Institute for Public Health and the Environment, Amsterdam UMC, and the North Tick Consortium.